Hey, this is Dr. Augustine here. It's Friday afternoon, and I'm excited because number one, the weekend's here. Hopefully, you're excited about that as well. But number two, we're holding one of our special thyroid webinars tomorrow, and I just got off the phone with a patient, and this seems to be a very common question to go along with our theme that we're answering little Q and A's. But why are my thyroid lab tests coming back normal even though you feel anything but normal? So I can totally understand your frustration. A lot of times women will get, lab testing done from the medical doctor, from the endocrinologist, and take a look for yourselves. I would say number one, make sure you're an advocate for yourself. What does that mean? It means asking questions, having them written down before you even go into the doctor so you can have a good conversation with them and challenge. You deserve to have your questions answered. Don't feel bad about that. A lot of patients feel, well, he's in a rush, he's looking at his watch saying, oh, I gotta go, you only have a couple minutes. But again, be prepared, and that saves both you time and saves the doctor's time as well. The second thing I want to say for being an advocate is make sure that you get a copy of your lab results, because I can't tell you how many countless times that people have said, well, my lab work is normal, yet when they get their own copies of their blood work, they can see clearly that there's an H there or an L there saying high or low that they were not informed of from their doctor's office for whatever reason that may be. So two things, again, be your own advocate, write down your questions. Number two, get a copy of your own blood work results and keep a little binder of it so you can compare back and look back. And then once you have all that information, start keeping a little bit of a log, and it doesn't have to be anything detailed of really how you've been feeling. Maybe you're on thyroid meds like Synthroid, levothyroxine, Armour Thyroid, but are you feeling any different? That is the key. And for a lot of women that I speak with, they've been on this stuff for a long, long time and are following directions, yet they're not feeling any better. And it's a frustration because, they go into their doctor, they're hopeful that they're going to hear something that's positive, that's going to lead them in a forward direction, but, and I'm sure you may have heard this, well, all your thyroid tests come back normal. I don't know if that's good or bad, right? I mean, I guess it's good, it comes back normal, but for a lot of women that I talk to, they're disappointed because they know they don't feel normal. Maybe you continue to have symptoms such as extreme tiredness, fatigue, weight gain for really no reason, and maybe even work out several times a week, or you watch your calories, and yet you continue to gain weight. And some of that can be from fluid retention, which often goes along with joint aches and muscle aches and things like that. And once those are there, it starts affecting your self-esteem and how you feel and how your relationships are, whether it's with friends, your spouse, and things like that. So you deserve to feel better, number one. And I can tell you, I see it happening day in and day out in our office. And hopefully, what we're doing, we get a lot of referrals. So hopefully maybe a friend or a family member sent you to our Facebook page to see maybe this video right here. And I'm glad you joined us. But this is only a little slice, a little couple minutes of my Friday share. But I want to invite you to a webinar that we're having. And if you go right above the video, you're going to see a link there. Go ahead and click on the link. It'll take you to our registration page for our thyroid webinar. You're going to learn a whole lot. You're also going to have an opportunity to get a couple things. Number one, you'll have an opportunity to get our free recipe guide. So that'll be on there. Number two, I'm going to share this with you. I've never done this before. You're going to have an opportunity to sign up for a free 15-minute consultation. So be on there. It's worth your time. Okay? Our webinars are generally pretty full. It's first come, first serve. With the technology that we use, we only have the availability to have 100 people on. It generally gets pretty close to that, 95, 98, 100 people. So again, first come, first serve. Go ahead and click on the webinar. You'll also have an opportunity to ask questions. There's lots of questions. Obviously, I cannot get to all of them, so please do not be mad at me. Usually once or twice a week, I'll have somebody email in and say, you didn't get to my question. It's not because I don't care. It's not because I'm ignoring you. It's because we get so many of them. And that's why I'm taking this opportunity here to go over some of those common questions and answers. So again, until we talk next time, go ahead and click like on our Facebook page, share it with a friend or family member that may be, suffering with thyroid problems or a chronic health condition that maybe they don't even know the reason why. So again, go right above, click on our registration link that we have right above. Again, it's totally free, and I look forward to having you on that webinar. Have a great weekend, and I'll catch you next week on next week's segment. Take care.